Okay, the floor is yours.
Awesome. I'm just gonna try to share this. Let me know if you can see my screen. Can you see my screen okay?
Yes, we can see it.
Perfect. Sorry, they just gave us these iPads, so gotta figure them out still a little bit, but okay. So first off, thanks for having me, Dr. Zelentsov. My name's Hieu. I am new to Intuitive, but we're excited to finally be a part of Canada. We came from 6 months ago, we were working with a distributor called Minogue. Since then, we've gone direct with Intuitive, and now we are hoping to expand the usage of robots in Canada and the amount of robots in Canada. So we're excited to be here. And why is that important for you guys? We have a lot more resources now. So the cost of the robot has gone down significantly. But on top of that, we've also been able to provide more resources to surgeons. So historically, the training was a lot less, the proctoring was a lot less, but now we're able to provide those resources and basically whatever the surgeons need to be successful in their launch of robotics. So looking forward to working with you guys. With cardiology, we do currently work slightly different. So it wouldn't, we would go with a different training route, but we'll cross that bridge when we get there. So I just want to go over a quick history of the robot and then what our 4th generation Da Vinci surgical systems look like. So things, of course, have changed throughout the years, and this will kind of highlight that. Our mission statement: we believe that minimally invasive care is life-enhancing care. Through ingenuity and intelligent technology, we expand the potential of physicians to heal without constraints. So that is the company's motto, and I feel like we follow it very well. Again, just designed to be to help you be successful. As you can see here, one of the most important things for us is making sure the patient gets the best care possible. And the way that we're doing that right now is just making sure that we're creating as easy of a hospital environment for the patient, but for the surgeons and the staff as well. The challenge of generating reproducible surgical outcomes. So with patients with significant pre-op comorbidities are associated with 2 times more complications. And the bottom quartile surgical skill had 3 times more complications and 2-time increase of readmissions than the top quartile. Going back to the piece where we want to create an easy environment. These are companies I'm sure you guys are all familiar with. One of the things that Intuitive aims to do is kind of bring that all together. And on the left-hand side here, you can see that these are advanced instruments, scopes, towers, operating table, energy, accessories, and simulations. What Intuitive has done is we've kind of brought that all under one umbrella. So everything that you see on the left here that is offered by all the companies on the right, a lot of it now we're able to offer directly from Intuitive ourselves. So we're very excited to continue to keep working with hospitals and see what else we can integrate into our environment and into your environment to, again, hopefully help provide the best care for patients. Here, striving to create reproducible surgical outcomes. Again, just decreasing the variation, creating universal room setups. At your hospital right now, you have the XI. So again, that's going to create a very reproducible room. The robot should be able to approach from the same spot every time. The console should be the same, table should be the same. And that's going to just allow the hospital to attack its priorities, right? So better quality of care, contain costs, improve patient experience, and improve physician experience. On top of that, I'd also add improve staff experience. Just makes things a lot easier for the staff as well, and just helps them be able to manage their time a lot easier. One of the things, of course, important to us, we are realistically a tech company as well. So innovating for minimal invasive care is something that's very important for us. As you know, our surgeon console is 3D HD vision, and our instruments are wristed. So we're looking to, of course, expand upon that, what we hold for the future. I can't really talk about, but I'm excited for where our company is moving towards and what we're able to innovate moving forward in the future as well. Again, these are parts of the process that we all want to be involved in. So just preparing before a case, usually you'll see a Da Vinci rep being involved with that, just making sure everyone's prepared. We're usually in the cases as well, just supporting, helping with the technical aspects of the case, and then sharing our insights after. So later we'll go into a little bit more detail about the insights that we do have, but we want to make sure that we're providing the best service possible, and that's right from the beginning right to the end. With the Da Vinci, with our 4th generation system, you're able to help a broad range of patients. So here it's showing a larger patient with, of course, an extreme position, but it also speaks to the different amount of indications that we have. As Dr. Zelensov mentioned earlier, we're currently working with urology. We're going to look to expand to thoracic, gynecology, hopefully cardiology, and then general surgery as well. So yeah, it's pretty diverse, and we're excited to hopefully help a lot more Canadians out with that. Again, just the quadruple aim of healthcare here. So this is a little bit of history here. The innovation that we've had, we started the company in 1999, and we launched the Da Vinci standard. A little bit of background. This was actually a company that was hired by the US military to be able to perform surgeries abroad, is my understanding of it. That's the original reason why it was developed, but now it's since morphed into what it is today. Of course, we're not doing anything abroad. The console is in the hospital, and the surgeon is there as well. So again, they launched with the standard. You had to be able to screw the instruments to the cannulas, and my understanding is quite cumbersome to do. Then they moved on to the Da Vinci S in 2006. So it took quite a while to make that leap. 2009, they came out with the SI, which some of you might be familiar with. And then in 2014, we actually launched the XI, which is our current most advanced robot that we're using. It's the one that St. John Regional has. And then we launched the X in 2017. It's going to have some limitations. With the XI, you have the boom that's able to maneuver itself and be able to adapt to different room environments. With the X, you kind of have to go back to SI kind of docking styles. So you have to sometimes change the room around, but you have all the 4th generation technology on that as well. And then in May of 2018, we launched the SP, which is our Da Vinci single port. Super excited for that. It's starting to take off in some areas like Korea, and of course in the United States as well. And same thing, we've always been proud of our innovation. Of course, we launched the operating system early on. Now we're able to connect to the internet in 2006. We have a simulator that allows the surgeons to practice before they start doing cases, and then also just practice if they've had some time off, just to be able to get used to the movement of the robot again. Again, enhanced vision came along with that, and now we're moving on to things like analytics, different configurations, and apps like Iris and MyIntuitive, which I'll talk a little bit more about later. The amount of surgeries that we've done with the Da Vinci has increased year over year. As you can see, in 2002, started very little with about 5,000 procedures. And now, as of 2019, we're up to nearly 5 million procedures. So yeah, it's pretty exciting to see that the growth has changed so much year over year, and it's only continuing to grow. So we're excited to hopefully keep continuing to provide this level of care for patients and hopefully make it the standard. So, and then again, just the impact that we've been able to have. So 7.2 million procedures, 67 countries, and 21,000 publications. So this is everything that we have in our 4th gen right now. There's going to be a few different components to it. So you have the surgeon console, which is where the surgeon operates. You have your vision cart, which is just basically the tower. It's going to display what the surgeon is seeing, but in 2D instead of 3D. This is also where you're going to be able to plug in your energy, your endoscope, and then any recording devices. One thing that's missing from the slide is now we actually have something called our hub system, which is allows you to integrate and record, share, cut, bookmark your procedures using our vision system as well. So it's also going to allow you to have virtual proctoring, and then basically allow a surgeon to kind of see into your room and help out with that. The consoles, the actual patient carts that we have is, again, the Da Vinci X, the XI, and then the SP. A new addition that we've been doing is this dual console. So one of the nice parts about having a dual console is being able to teach someone while you're operating. So one console can kind of act like a student driver, right? They're taking handle of the operation, but the other one's allowing you to stop. It's allowing you to point out certain parts of the procedure or the case, and then allow them to teach a lot easier. So that's been a very popular addition for our academic centers. And then the integrated table motion here is going to allow you to move the robot and the table while it's docked. So without the ITM, you're not going to be able to do that. So it's a nice addition that a lot of surgeons were asking for, and we were able to integrate into our technology. Here at the bottom, you have the instruments. So we're looking to bring in more advanced tech. You have your vessel sealer extend and the synchro seal, which are going to allow you to cut and seal. And then you have your Sureform, which is, of course, our stapler. So nice thing with that is, again, you have a wristed stapler rather than just a straight lap stick stapler. So a lot of people have really liked that. And then the force bipolar is a new instrument that we have as well. It's going to allow you to switch the grip between a weaker grip and a stronger grip. So, and of course have bipolar energy as well. With our vision, we have our handheld camera, our endoscope plus, which is what plugs into the robot. The handheld camera allows you to attach a 5mm camera to your vision cart. And then we have Iris and Firefly. So Iris is a new piece of technology that I'm still learning a little bit about, but it allows you to kind of overlay scans, I believe, CT scans and that with your procedure. Again, not available in Canada yet. I'm still learning about it, but I am excited to learn a lot more about that. And then Firefly is allowing you to illuminate your ICG and to be able to see that perfusion and the movement of blood a little bit easier. With our training technologies now, again, we have telepresence. So that's going to allow you to basically video or voice call with another surgeon from somewhere else and allow them to see what you're seeing in your console. And then we have our sim now, as I mentioned earlier. For insights, we have a few different things. So QTIs is what we used in the past. It's basically what the impact that using the Da Vinci has had for patients, hospitals, and for surgeons. So one of the great stories I like to tell is we've had surgeons who had to discontinue or had to stop doing surgeries laparoscopically or open because of the strain on their body, but were able to extend their careers because they were able to be robotically trained. So one of the great things about, of course, having the robot is you have that better ergonomics that you're able to take advantage of. And then here we have my intuitive app at the end. So what that is a new app that allows surgeons to track their data, know what instruments they use, how long they use it for, and be able to compare themselves against other surgeons if they want. So that's something that we're very excited for. It allows them to also track and have easy access to what procedures they've done and how they've been improving and any other kind of data that they want to track in regards to the procedure. So we're excited to have that launch in Canada very soon here. But yeah, it's doing really well in the States right now. Indications for use, as you can see, it's evolved over time. So gynecology was the first one that kind of came out, but I think if you look historically, the machine actually was designed for cardiology. So, but yeah, over time, as you can see, more and more indications have been added, and we're hoping to only add more. And then again, it's just going over what we've added for our 4th generation here. One of the best things about it is we've added this guidance. So in the past, you wouldn't have this guidance for the staff or for surgeons, or even for me, to be quite frank with you. It's great. If there's ever any kind of errors, the machine will guide you, tell you what you need to do to change it or fix it. And then if you're ever unsure about how to use an instrument properly or anything like that, all that guidance is there. So it's a really smart machine and makes things a lot easier for everybody. And then again, you have your ITM with your integration, learning, and then your data and analytics. And then here, again, just as we update our software, you're just going to continue to get more and more out of the robot. So every time we do an update, basically some sort of new feature gets released, and it's able to just basically make everything easier for the surgeons and the staff. So and then here, as I showed you earlier, this is the boom mounted patient cart. So the boom's actually able to shift around, rotate, extend, which basically allows you to drive the cart in from a variety of different places and just make things a lot easier. And then again, we're designed for a broad range of surgical applications. So as you can see here, cardiac, thoracics, gynecology, general, and prostatectomies. So as well as kidneys, as we know. And then, of course, we're always continuing to innovate. We want to be able to increase the reliability of our instruments, the performance of it, and the durability. So within the recent years, we've been able to extend the lives of these instruments because we've continued to improve on the the performance of the instruments. So again, this is the integrated table motion that I talked about a little bit earlier. It's going to, again, move around the, allow the table to move while the patient is docked. So if there's ever an adjustment that anesthesia needs to make or the surgeon needs to make, maybe to take advantage of a little bit more gravity, it's definitely something that we're able to do now. So I'm excited about that. And then again, the sinker seal we actually don't have available in Canada yet. It might be something coming in the future, but the vessel sealer extend is something we're very excited about. When you pair it with our new generator, the E100, you're actually able to seal and cut vessels of 7 millimeters, up to 7 millimeters, and it's extremely quick. So I've seen, you know, some surgeons be able to take advantage of that pairing and increase their surgical times with it. So. And then just a little bit more here on the vessel sealing. Again, we've come up with a new generator. So currently we're using the Irby, but the E100's come out. It's just going to allow you to have maximum efficiency and continue to operate a bit quicker. Here with the stapler again, again, one of the most important thing is you have full autonomy with the robot. You're going to be able to have that wristed instrument ability as well. So getting into harder to reach places and being able to navigate with the robotic instrument is a lot easier. This intelligence piece is actually something that is pretty interesting. So it's always going to measure, it's going to do over 1,000 measurements per second. So what that means is it's going to measure for compression. It's going to measure to make sure that, you know, it's not going to do anything that is deemed dangerous. So again, that's going to allow just for a more consistent staple line, and it's going to eliminate, of course, the chances of having a little bit less accuracy. And then, yeah, that's just going more into the compression that, of course, we can dig into a little bit more in the future. But again, it measures it and then it fires out the knife there, and it's going to cut and staple at the same time. So force bipolar, again, something that I went over earlier. As you can see here, you have your strong grip and then your regular grip. So just for the surgeons who don't want to switch instruments out too often, this is kind of a all-purpose instrument that they're able to use and something people have been really happy about. Okay, and then again, we're always looking to innovate and improve our technology. So as you can see on the left, that was what our original scope looked like when we first came out with the XI. And since we've come out with the Endoscope Plus, which is a lot more clear, it's going to allow you to see things a lot easier. So we're excited to hopefully keep innovating in that sense. And then here, you do have the ability to plug a 5mm camera in, and that's just going to allow you to use your current 5mm cameras onto our tower. Okay, and then again, this is Iris, as I mentioned earlier. So you're able to review 3D imaging and plan for your case, communicate the findings, and then add those 3D images to the user interface using Tile Pro. So again, something we're really excited about, but I have yet to learn a little bit more about it. So, and then yeah, as I mentioned earlier too, having a remote proctor, being able to see your entire room, see what kind of case you're doing. That's something we're making a lot easier. I mean, one of the challenges I'm having is in Canada, we don't have a lot of case observation sites. So I wish this is something that was already available in Canada, because right now everyone has to fly to the United States to get trained, and we have to bring in proctors. So Yeah, same thing there. And then again, the simulator now is really good. You're able to practice different kinds of cases, but also a ton of different skills drills. So it's really helped surgeons get over the learning curve a lot easier without, of course, adding too much of an incremental cost or being able to having to burn lives on training instruments. So, okay. And then here again, just QTIs and the analytics that we're able to provide for you. And then the My Intuitive app, which is coming. As you can see here, it allows you to see how many of each cases you've done, console time, instruments that you use, the amount of time you use the instruments for, and then be able just to compare yourself with other surgeons. So, and that's pretty much everything I have. So if anyone has any questions, I'd be happy to answer them, but that's all I have for today.
Hieu, thank you so much for such an informative presentation. Everyone just chip in with their questions, please, if you have any. So
Yep. So wait, sorry, I documented. Yeah, so in the past, we're still a relatively young company, right? We released our first machine in 1999, as you saw. And the training wasn't consistent, and it wasn't, to the standard that we have it at today. Now we are a lot more standardized. We have a whole set layout, and that involves a few different steps. So just again, ensuring that the surgeon, it's something that the surgeon wants to do. They would go for a case observation to ensure that they're able to see how a full functioning smooth program would run. And then they'd spend a lot of hours just training with the reps. And then of course, moving on to doing live training days at a lab, and then moving on to having proctored cases. So we've gotten to a point now where it's gone really smoothly, and it is a lot more consistent and laid out. So and again, it's different for each indication, but if the surgeon requires continued training after that, now that we're direct with Intuitive rather than through a distributor, it's something that we're able to provide.
Thank you. I have a question.
Yeah.
So on top of decreased invasiveness of the procedure, can you summarize what additional advantages the robotic platform provides?
Yeah, so of course it is an MIS procedure. Some of the big things is you have that enhanced 3D vision. So you're going to see, I mean, a lot of companies have 3D vision now. Ours is something we've done and perfected over the last 26 years. But the ergonomics piece, as I mentioned earlier, is a huge one. Open surgery, lap surgeries are not easy. Standing a lot, you're usually getting into some uncomfortable positions to be able to work with the straight sticks for lap, right? And the Da Vinci kind of takes that all away. You're able to sit throughout the whole procedure. Most of the staff is sitting, so it's kind of funny to see. And then you have your wristed instruments. So that's going to allow you to be able to get into those tighter spaces and be able to have a lot more control and accuracy. So precision is another big thing.
Thank you.
Yeah.
Okay, any other questions? Okay, I think we're out of time, and thank you, everyone. Hieu, thank you again for a great presentation.
Yeah, thanks for having me.
Hope to keep working with you.
Yeah,
thank you.
for sure. See
Thank you, everyone. Have a good day.
Bye.
Bye.